My name is Jordan, and my research topic is: would patients older than 65 who take meter-dosed inhalers have higher compliance with spacers if educated on multiple occasions versus patients that have only received one education session? The main goal of this question is to observe the relationship of repeated education to the repeated use of spacer use with MDIs, especially with a generation known for having difficulty in altering behavior. Compliancy can be a determining factor in quality of life for patients, giving them more opportunities, while noncompliance, especially in COPD patients, can increase incidences of exacerbations and lead to further decline of health. Altering the way patients are at home away from medical professions so that they take medication as prescribed can be an uphill battle with obstacles such as healthcare literacy. As healthcare professionals, we understand the implications that not taking medication properly has, but the general population has the difficulty sharing that understanding. Finding ways to bridge that gap can increase compliance and give patients the ability to do more with their lives. The aim of the study is to observe the correlation that certain characteristics in the population, such as income, education, or gender, and how it might influence the ability to comprehend educational sessions. This can highlight the second aspect, that is to observe the relation between the number of educational sessions and how often the patient is compliant. To get a well-rounded view, a mixed method approach will be utilized, showing statistics that can highlight certain numerical aspects while delving deeper with observational aspects from the patients themselves through open-ended questions. Initial steps involve approaching patients who are over 65 and take meter-dose inhalers regularly with a survey that contains quantifiable answers. Whether the patient is educated once or multiple times should be done through systematic sampling. Since we are looking at correlations, the use of chi-squared should be a useful analysis tool in finding if these relationships are significant or assumed. A secondary survey or interview will then be conducted in order to understand what the patients feel made the most significant difference in their compliancy. A thematic analysis will help to separate and highlight words such as education, technology, or family, helping to remind the patient to use their spacer. The analysis will be used as to gain a general understanding throughout the interview. The method could lead to some bias with the patients, but emphasizing anonymity would promote the more truthful answers. Overall, finding connections between education and compliancy could promote increased healthcare literacy and increase patients' overall quality of life if implemented correctly. Long-term use could see an increase in positive relation between healthcare and patients.